Right. So just a quick introduction to the topic today. Why the focus on COVID, the lessons from COVID in education. The situation right now is that COVID and other airborne infections, from flu to colds to whooping cough and etc., are spreading entirely unmitigated in schools and colleges across all of the UK, including in Scotland. And by the way, there are signs, certainly from England, that we're now at the start of another COVID wave. No idea how big it'll be, but it's going up again for the first time in 18 weeks. ONS data, before it was stopped, long COVID data showed that teachers are the second most at risk group from long COVID after healthcare workers. We do know that even after that survey stopped, the long COVID number of people suffering from long COVID are continuing to rise, according to the latest GP data, which I don't think even includes Scotland. Not 100% sure that's true, but now stands at 3.1 million across the UK. Long COVID Kids Scotland estimated around 10,000 children in Scotland with long COVID. That was about a year ago, so maybe more now. We also know that the vast majority of absences from school have been due to infectious illness, and I'm going to share a link about that in the chat afterwards. And finally, according to a US study from the USA published in 2023, over a 3-year period, 70% of household infections with COVID were found to have started with a child getting infected normally in school. So it's, for anybody concerned about public health in general, this is a really big topic, a really, really big concern, the total lack of mitigation against airborne illnesses. So let me introduce our first speaker. The first speaker is Mike Corbett. He is a national official for the NASUWT in Scotland. He was a secondary English teacher for 26 years and a union activist for much of this time, latterly being elected to the presidential team of NASUWT across the UK. His various roles for the union over the years included local secretary and member of the national executive. Mike became a full-time official with NASUWT in late 2021, and we are particularly we are grateful to Mike for speaking anyway, but particularly grateful that Mike jumped in, not totally last minute, but fairly last minute after Linda, his colleague, who was going to present, unfortunately took ill. So, Mike, you have the word.
Thanks very much for that, Almuth. And yeah, apologies, I'm the late replacement for our ex-president Linda Gibson. Linda's still a real live teacher with experience of teaching during COVID and quite a bit of experience since then of campaigning for air quality improvements. So it's unfortunate she's not been able to make it today. She's off sick at the moment, and you're stuck with me instead. The topic is massive, isn't it? If you're just talking about looking at education and the impact of COVID and where to go next, and you could spend days on it. It's probably worth just sharing before we get into the focus on air quality. That certainly I think is the key area we're going to look at today. Just what we at NASUWT Scotland have done in terms of the Scotland COVID-19 inquiry, which we've, as a UK-wide union, we've had some experience of both the Scotland inquiry and the UK inquiry, and that experience actually suggested that so far, at least, the Scotland inquiry has been much more open and certainly much more encouraging about submitting data on equalities and human rights, taking a human rights approach. So, our experience so far of that has been quite good. Inevitably, public inquiries take a long time, but we have submitted in Scotland, I think, over 300 pieces of documentary evidence. So that's from advice to members, correspondence with government, but right through to, and importantly, I think, testimony of members who've actually got long COVID. So that all went in, sort of full witness statement from me of 15 pages. And then I was invited to give oral evidence in November to the inquiry. So if you're spectacularly bored, you can actually get that on the inquiry website, where the counsel to the inquiry quizzed me for about an hour. But all of that, I think, gave us a real opportunity to give a full response on behalf of our members to all of the issues during COVID, but also since, it's not been at the forefront of people's minds as much. So that's been a useful opportunity, and hopefully, because the UK inquiry is, I think, lagging behind a bit now, but we'll get the same opportunity to do it at the UK COVID inquiry today. Later. But the key focus today is air quality. So I will go kind of back to the beginning of COVID with my story, and it's been touched on. I'm a full-time union official now, but yeah, I was once a real live teacher, and that included during COVID. So I taught through both of the lockdowns, out the other side of each. So had first-hand experience of what it was like. So what it was like teaching from home, which was, I think, difficult and pretty miserable for all involved, teachers and pupils. What it was like tentatively getting back into school buildings with the hand gel, the spray, the wipes, the masks, and quite honestly, the fear, I think, much of the time. And then what it was like eventually getting out the other side of that and returning to some kind of normality. But I would say we're still some way, even today, from being back to normal, whatever some politicians and school leaders might think or say. Now, as was touched on in the introduction, so I switched to this full-time union official role in late 2021. So at that stage, teachers were back in schools, but there were still plenty of mitigations around. And really, I was immediately plunged into meetings and negotiations with Scottish Government, with COSLA and others about those mitigations. And one of the very first things that I was heavily involved in discussions about were CO2 monitors. Because that was really, a live issue at that point in that autumn of 2021. And I suppose I got an early lesson in government over-promising and under-delivering, and, how the blame game works. So at the time, we as unions and our members as teachers had been advised there'd be a CO2 monitor for every classroom or teaching area in Scotland. But the reality at that point, certainly in October 2021, was that just was not the case. We had members who said they didn't have a CO2 monitor, or they were asked to share a CO2 monitor. So in what became a familiar pattern to me, really, Scottish Government trumpeted, there's additional funds that we've given to provide CO2 monitors, which was true, but they didn't really have any kind of delivery plan worked out. And so when, fairly predictably, some councils either didn't buy enough CO2 monitors or they didn't distribute them properly, Scottish Government blamed COSLA and local authorities, COSLA and local authorities blamed Scottish Government. And that's a familiar pattern, unfortunately, even today in other areas. Now, to be fair, things did improve, partly because of the pressure we put on, I think. And I think latterly we did have CO2 monitors in most schools and classrooms across the country, although, again, the actual models purchased varied in terms of their quality and their reliability. So that, probably in a fairly meandering way, brings me to what I think is one of my key first major points anyway. The pandemic really taught us the importance of monitoring CO2 levels. So we learned that they were not just a useful indicator of the need for more fresh air, they were also a marker of poorer pupil engagement. Although there was evidence, I only found this out later. I mean, apparently the first evidence of high CO2 levels having a significant negative impact on cognitive ability was in 1904. So maybe it was just more of a reminder a century later that, look, you've got high CO2 levels in an enclosed space, people are not going to work very well, and certainly pupils are not going to work very well. It also did show us at the time the power of sharing information. As I touched on earlier, we had a UK-wide union, and our colleagues in Wales had shared with us what they'd managed to convince the Welsh Government to do at the time, and that really helped us convince Scottish Government and COSLA to do the same, which was to use that vital 800 to 1500 parts per million measurement as essentially an amber warning in national guidance that went out about CO2 levels in classrooms, because as we know, when levels of CO2 reach that 800 parts per million, that's really where you're beginning to breathe in air that's been exhaled by others in a room, which clearly in terms of COVID times was a recipe for spreading COVID, but even today that's a recipe for spreading any other respiratory illness. And we were quite pleased at the time that simple but important piece of guidance, about that, as soon as it gets to 800 on your monitor, you need to be taking some action. That was a really useful thing to get into that COSLA guidance, which went out to teachers and employers across the country. Now, we then took that kind of knowledge and experience into more kind of post-ish pandemic discussions and policy making. And I suppose that's really where it's a shame that Linda's not here today, because she was a class teacher, she was a physics specialist as well. She was a health and safety rep and a senior activist with NASUWT. So actually at the time she was our Scotland president. So she was ideally placed to then join in 2023 Scottish Health Protection Network working group, which was looking to develop health guidance for settings with children and young people. And I have to say, most of the work that group did was really good. Huge amount of good work. And then early 2024, so we're just on the cusp of the guidance being published, and Public Health Scotland, who were really directing it, they sent us some information, much of which I think is really useful in capturing what's vitally important. So they said to us, we agree that the aim of the SHPN, Health Protection in Children and Young People Settings guidance, is to provide the best possible advice to minimise the risk of infection spread. So that's good. We're all on board with that. We are also all agreed on the consensus that air quality is important for health. Right, again, this is great. That's in there in this guidance. And we agree that the use of CO2 monitors can inform settings when indoor air quality is better or worse. So great, so far so good. That's all good stuff that was going into published guidance, and it did eventually go into published guidance. So that was really positive and quite simple and hopefully effective messaging. But they did then go on to say, it's only the use of specific levels of CO2 to determine specific actions that Public Health Scotland reviewers feel is not appropriate. Hence the removal of the table containing set advice at set levels of CO2 concentrations. So in other words, that enormously helpful table to us that we'd originally convinced COSLA to agree to put into national guidance about that, that marker of 800 parts per million, that was completely dropped from the published guidance at the last minute with no real satisfactory explanation of why. So that was hugely disappointing, although just as a very brief aside and update, Public Health Scotland did say at the time, we will review that decision after 12 months. And that's literally just about now, because the guidance was published just over a year ago. So we actually have hassled them just in the last couple of weeks to try and get that table back into the guidance. But largely there were positives around that, all of that work that we were involved in. So there's a national focus on air quality in classrooms and teaching areas, and the importance of CO2 monitoring as part of that. So we thought that was really very, very helpful. Now, much of that work around CO2 monitoring then obviously led to, well, if your monitor is going amber or red, you need to do something about it. And of course, the classic advice mid-COVID was open your windows. Now, I'm not going to bore you with all the ins and outs of what we found out about the state of some of Scotland's schools at the time. Rusty windows that wouldn't open, and some classrooms with no windows at all, and so on. But what that did was really switch our focus to the quality of the air that you're now looking to flow into classrooms from outside. And I mean, the sad fact is that too many schools in Scotland, the air quality around them is not great. So that then has opened up a couple of other areas where we've been campaigning and trying to, push government and others to take action. Now, one of those is really related to the immediate exterior of a school. And too many schools are obviously located near busy roads, traffic junctions, and the whole kind of idea of the school run and parents sitting outside, parents and carers sitting outside with the engines idling as they're waiting to drop off or pick up. That is a real issue in loads of schools around Scotland. So when we started doing a bit of digging on that, we found out that, and you'll see the signs, engine idling is prohibited in Scotland, but you wouldn't really know that because hardly anyone ever gets fined for it, despite the fact there is legislation allowing for fixed penalty notices to be applied. It's a local authority responsibility to enforce that law, but as far as we can see, far too often they just don't bother. But FOI, Freedom of Information responses from Aberdeen, Dundee, Edinburgh and Glasgow councils showed there were 760 complaints by members of the public across the period 2019 to 2023 about engine idling. And in that time, right, that's those 760 complaints, 760 people, actually, decided to do something about it and complain. 4 enforcement notices were issued, or fixed penalty notices. So as a result of that, we have been working quite closely with the Environmental Rights Centre for Scotland and some others on this. And earlier this year, we sent a joint letter with them and a number of others to the Cabinet Secretary for Transport, just saying, look, there needs to be greater enforcement of this law on engine idling around schools. So we've not had a formal response to that from the Cabinet Secretary yet, but that's just an example of some of the work, some of the lobbying we're doing around that particular issue, which is affecting air quality outside schools. Now, there are, of course, all sorts of other air pollutants that might affect the outside air that's flowing into classrooms if you're opening your windows to lower your CO2 levels. The World Health Assembly, talks about particulate matters, nitrogen dioxide, sulfur dioxide, ozone, amongst others. And as we know, children are among the most susceptible to air pollution. Infancy, early childhood, vulnerable times because the young body's growing and developing rapidly. There's not a fully developed immune system in kids. Kids spend, a higher proportion of their time outdoors, so they're, at greater risk of exposure to air pollutants. And again, predictably, but sadly, the poorest children tend to live in the areas of highest pollution. So that exacerbates, any kind of health inequalities. All of which means, I suppose, that we need to go beyond that advice of open your windows. So your CO2 monitor is showing that you need better ventilation. Open your windows. Well, not if you've got all of these, pollutants coming in. Which leads to the sort of last section from me, really, for now. So, and that's to do with air filtration. So we did try, but largely failed to get Scottish Government to take air filtration seriously during, the height of the COVID pandemic. But air filtration systems, shouldn't be seen as just a purely COVID-19 measure in our view, because, thousands of school days are lost every year because of absence from respiratory infections, cold, flu, etc. Loads of pupils and indeed staff have conditions such as asthma, hay fever, etc., and they're made worse by airborne contaminants. As was touched on earlier, air pollution due to traffic is a major issue around some schools. So, we pushed this during COVID, but we've been pushing it again now. High efficiency particulate air, or HEPA filters, as they're maybe more commonly known, installed in classrooms would remove pathogens, allergens, contaminants, and just make for a better environment in a classroom, better learning experience, reduced absence, you would hope. But they would also actually be helpful in classrooms in winter, because one of those issues that we had during COVID, when the one key piece of advice was open your windows, was in winter, it was absolutely freezing. So if you've actually got HEPA filters, they can help in terms of thermal comfort. You don't necessarily need to open your windows or all your windows if you've got a HEPA filtration system. And also, they clean the air without adding any dangerous chemicals to the air that some other devices do. So ionizers and ozonizers are maybe not quite as good. So we really think, HEPA filters are the way ahead. Inevitably, almost the key kind of barrier that Scottish Government put in our way when we suggested the provision of HEPA filters during COVID was cost. But in our view, a HEPA filter probably would pay for itself very quickly by reducing absence rates and improving that learning environment all round. So that is another kind of key strand of a sort of campaign area for us. So we're lobbying on that at the moment as part of our work with the Trade Union Clean Air Network. So as I say, I hope that's just, just by exploring that kind of one small strand, around air quality sort of during and post-COVID, that at least gives you a sense of what some of our activists have been doing and how we've been working with others and what is possible to try and, get things moving and get some improvements in this area. So obviously happy to take any kind of questions, expand on any of this later, but also, keen to leave some space for fellow speakers as well. So thanks very much for listening for now. Thank you.
Yeah, thank you very much, Mike. Thanks. And I don't see any questions for clarification in the chat, so we can go straight to our. There will of course still be the Q&A after the three speakers. So let's now welcome our second speaker. Our second speaker is Natalie Bain-Reguis, associate researcher at Edinburgh Napier University. Natalie has a background in building physics. She's been looking at ventilation strategies and thermal comfort in Scottish classrooms, i.e. exactly, the issues, some of the issues that Mike flagged up, and the impacts on the health and well-being of teachers. So Natalie, welcome. And I think you are able to share your screen now, if you, because I know you have a presentation you should share.
Many thanks, Almus, for the presentation, and good afternoon to everyone. So I'm going to present my work related to education and what we have learned from COVID, and it's going to be very similar to what Mike has just said. You will see. So I started being involved in schools and COVID issues in 2019, so a few months after the pandemic started. And, sorry, I cannot move this. Here we go. So I'm not going to explain in detail the transmission and contamination modes of airborne viruses. I'm sure you are all aware of this, but I just wanted to insist on the importance of ventilations as mitigation measure for this type of transmission. That in mind, these are the three key points I'm going to talk about today. So before exploring the impact on ventilation and how to enhance it, we are first going to have a look at the regulations for ventilation in classrooms in Scotland. Then I will report on the study I've done in 2 schools during the COVID pandemic. And finally, I will mention how to enhance filtration. And all this, after each key point, I will suggest key actions. So first, here are the Scottish regulations in schools as of March 2020. So classrooms should be at least 70 degrees Celsius. The CO2 level should be 800 ppm max in music rooms and sports halls, and 1,500 in normal classrooms. Measuring the CO2 levels gives a good indication on how well an indoor space is ventilated and has been proven to be a good proxy for ventilation. But we know that very often CO2 levels are above the 1,500 ppm max. So I've done a review of other regulations and guidelines in other countries. So that's what you can see here. So on your left, you can see the countries and the red bars represent the countries with regulations, the blue ones, the countries with guidelines. And then on the far right, you see the international organizations like the WHO, ASHRAE, RIVA, and CIPC. So we can notice that Scotland, which has a maximum of 1,500 ppm, is above the CO2 level average of 1,100 and something. And is way above the 994 ppm recommendation by the international organization. 7 countries have tightened their maximum CO2 level since the pandemic, so that's a good point to note as well. Now, looking at the minimum ventilation rates, so it's above in Scotland, most of the other countries. Just touching on this. Then about relative humidity. So that's the last point I wanted to mention. So when because relative humidity has an impact on the indoor quality of a room. So when it's above 60%, mold can start developing. And when it's below 40%, the air becomes too dry and the viruses can spread more easily. So numerous studies have identified the relative humidity sweet spot between 40 and 60%. But the thing is that in the UK, there is no currently mandatory legal requirements to control relative humidity. So regarding the regulation in schools classroom, the suggestion would be to align the figures to the strictest findings. So having 800 ppm as a max for the CO2, ventilation rates above 12.5 and relative humidity between 40 and 60. I've been really quick on this, but yeah, it's in my mind, it's important to make the distinction between regulations and guidelines. So regulations are enforceable by law, which should be the case for that type of topic. Now moving to the second key point about ventilation. So this diagram from Jones and colleagues is showing the 3 steps to reduce airborne virus propagation. So the first step would be to know what type of ventilation we have in the room and then act accordingly to our findings. And the second and third steps are about air filtration and air cleaners, which will be detailed in our third key point. So first, finding out which ventilation we've got in the room. So depending on the type of ventilation, if it's natural or mechanical, there are different strategies to put in place. So for natural ventilation, cross ventilation is the most effective way to ventilate, as it takes only 7 minutes to replace the air in the space compared to 45 minutes when there is only one single opening, or several hours if all the doors and windows are shut. For mechanical ventilations, the system should be kept at 24/7 running with no air recirculation. So very early on, during the first lockdown, the City of Edinburgh Council asked me to do a study looking at the CO2 levels and ventilation rates in different schools, classrooms around the city. And the outcomes were that when classrooms had well-maintained mechanical ventilations, the CO2 were within the regulation limits. So meaning below 1,500. That's what they were looking for. We know that's not, well, it's still too high, but it was within the regulations. But for naturally ventilated classrooms, it was a lot more difficult to keep those CO2 levels within range, so below the 1,500. Following these findings, I wanted to explore more what can be done to enhance the ventilation in naturally ventilated primary schools. So the council manages 89 primary schools, and 90% of which are naturally ventilated. Also, the Scottish Government allocated £10 million to local authorities to have CO2 monitors deployed in their schools. So I took this opportunity to look at the impact of such measures, and I took 2 similar Victorian primary schools with sash and case windows. So School T, where visual and non-visual monitors were deployed in 10 classrooms, and School S, where only non-visual monitors were deployed in 10 classrooms. I have recorded a webinar, so all the teachers from both schools could watch, and where I explain the importance of indoor quality, how to use the visual CO2 monitors, and how to enhance, practically how to enhance ventilation in their classrooms. I have monitored the indoor environment, so temperature, relative humidity, and CO2 for 8 months. And I've also asked the teachers to fill in surveys to explore what they felt about the physical and mental well-being, but this is not good. I'm not going to talk about this today. So the results of this study showed that raising awareness via the webinar helped reduce 7% of the CO2 levels in School T and 5% in School S. But when the schools had, in addition to the webinar, visual feedback monitors, then the CO2 was reduced by 14%. So you can see on this graph that the CO2 for S is in red and T is in blue, and then there's a difference between the two. So the blue one is where classrooms had visual monitors, and the red one when they didn't. Another outcome of this study, when looking at the CO2 levels of individual classrooms of school T, so only the schools where the teachers had visual monitors, it was how the teachers themselves used those monitors. So 2 of the 10 teachers of this school T had really low CO2 level throughout the study. So I went and asked them what was their strategy, and they both said that they kept the upper pane of the sash and case window always open, even during the cold months. And they used the visual monitor to open and close the bottom pane. So when it was too cold, they were closing it, but keeping an eye on the CO2 level. And when the CO2 level was too high, they were opening the bottom pane, keeping the upper pane always open. And that way the classroom was well ventilated without being cold. So that's one classroom, one of the teachers who has done this. So you can see most of the CO2 levels throughout the year is around 800 ppm, with peaks a little bit higher, up to 1,000, but well, generally it's acceptable. But I would add the last comment. It's related to when a supply teacher was in this classroom 1 week towards the end of the study. It was in June, so the weather was not too cold. And as you can see, so during the previous weeks, as I've said, all the CO2 levels are very irregular and mostly around 800 ppm. And the normal class teacher was one of the 2 who are really, who I've mentioned, and really used the strategy with the windows and the visual sensor. But towards the end, there is a big difference in CO2 levels, reaching above 1,600 ppm. And the supply teacher was unaware of the study and didn't know how to ventilate, nor to use the CO2 monitor, not even to look at it. He didn't even know he had a CO2 monitor in his classroom. So these observations led to this conclusion: to enhance ventilation in this classroom effectively, first occupants need to be aware, meaning they need to know what indoor air quality is, why it is important, and how to enhance it in their classroom, but also have a CO2 monitor to check levels regularly to be able to act accordingly. And the second element, the occupant needs to be willing to act. The teachers are already overwhelmed at the work they have to do to teach their pupils. It is understandable that managing the ventilation of their classroom can add pressure to their workload. That's actually what a lot of teachers said when they have been filling in the survey I've asked them to do. But in times of pandemic, they need to know and act accordingly to reduce the risk of viruses spreading. Therefore, the proposed actions on ventilations could be, so indoor air quality modules during teachers' training, so they will know how to manage their own classroom, developing CPD as well to raise awareness and, well, explain how to ventilate and use visual monitors, buying the appropriate CO2 monitors, so with the NDAR technology for CO2, and they should be also able to monitor relative humidity, having a dynamic alerting system, so either traffic lights, visual, or even acoustic, but that can be disruptive, having a user guide in every classroom specific to the classroom the teacher is in, and finally, clean air champions, so where pupils are in charge of the ventilation of their classroom. So the clean air champions is to reduce the pressure from the teachers, but also to educate children from a young age to ventilate properly, and then they will become part of the Scottish culture. I have been involved in actions to reduce outdoor air pollution this year in Edinburgh. And the program has been delivered in 20 primary schools around the city, to finish by an event at the city chambers where 200 attendees came, including councillors, MSPs, and MPs. So we could do something similar for indoor air. The last slide is about the third key point, and it's filtration and air cleaners. So multiple studies have shown the positive benefits of such measures. And adding HEPA filters in classrooms can be done by buying off the shelf, or also by building your own Corsi box. My 12-year-old at the time has been able to build one herself.
Thank you very much, Natalie. That was great. And I have one question in the chat, just for clarifying, asking if you could just explain again about the impact of relative humidity, what you mentioned about that earlier. That would, if you could just explain that again, please.
Yes. So relative humidity, when it's too high, when the humidity is too high, above 60%, that means that mold can develop inside, and then it has been shown to be linked to asthma issues. But when the relative humidity is too low, so below 40%, then it's too dry. And then that means that our airways are too dry, and that's a very good way of catching viruses more easily. But also because of the size of the virus, then they are transported by humidity. So if it's the humidity, if it's too dry, basically the virus is not going to be, it's going to be more able to spread. I hope I'm clear enough. Let me know.
Yeah, thank you. Great, that was very helpful. Thanks. And now welcome our third speaker, Gemma Clark. Gemma is serving as a primary school teacher, and she's also a trade unionist. She's writes articles for TES, the Herald, and the National, and she's spoken to STV, or she spoke to STV during the COVID-19 lockdown to advocate for safety in schools. And Gemma co-founded the teacher forum, Scottish Teachers for Positive Change and Wellbeing.
So I'm not an expert on COVID or anything like that. I'm just a teacher who was working during COVID and co-adminning a group with some other teachers. So we got quite a lot of other people's experience. I think kind of quite a true picture of what was going on in schools for teachers. And I think the kind of there's a lot of buzzwords in education all the time, but I think the buzzword for teachers that year would have been gaslighting. I think that's the word that a lot was used to describe what the experience was like. So just a bit of a kind of recap of that time. There were kind of, we were told things like the virus doesn't spread in schools, it waits at the school gates, it's not going to come in, you're fine, you don't need to do anything, but also we'll saw the bottom of the classroom doors because that'll help. So things like that. So apparently not spreading at all, but also we'll cut the bottom of classroom doors. Pretty much we'll do anything apart from give you ventilation. There was a lot of teachers who had pupils who were shielding, but they were not allowed to shield themselves. I do know some very clinically vulnerable teachers had, their own individual risk assessment, but it did seem to be a bit of a postcode lottery. It depended on the school, the leadership, where you were working. Also, it felt like kind of one rule for teachers, one rule for everybody else. Completely sympathise with Mr. Swinney and his clinically vulnerable family members, but a lot of teachers were clinically vulnerable themselves. A lot of us had family that were very clinically vulnerable, and I think the feeling was that we were just kind of left to get on with it. There was a lot of kind of backlash against mask guidance. Coming from the primary sector, children in the primary setting were not required to wear masks at all. I did have some pupils who actually wanted to, but there was a lot of backlash against that, even if it was a choice that pupils were choosing to make themselves, which I think they have the right to do because they've got clinically vulnerable family members, they've got their own anxieties. And any pupils that I certainly had, it's completely up to you, your choice. You can wear your mask if you want to. I did have a pupil during the worst of it who had very vulnerable family members, about as high risk as it can get. And I was living in fear that I would be the one that would bring COVID into the classroom and pass it on to this pupil, which would be a very difficult thing to live with. So when the lateral flow test became available, I was using these constantly because I was very concerned about this pupil who was genuinely at risk of losing one of her parents and a sibling during that time. There didn't seem to be anything to protect her from me or anybody else in the classroom. Then we had the, defending decisions to chop the bottom off doors. during that time, I was also around the time of the election, I was at a hustings with various political leaders, and the thing about doors was then denied. No, that's not something we were ever going to do, but we all know that it was, and that it was brought up. It was well documented. Something that's, I think, is worth mentioning, this is still an ongoing thing, is that all the kind of the discourse around COVID brought Scottish schools quite into the kind of far right and conspiracy theory spaces. There are some people who go into schools and deliver training that were kind of peddling this anti-mask, anti-vaccine, anti-mitigation measures, spreading things like saying, oh, well, it's just the cold. I think every single teacher during lockdown got to know this group, Us For Them Scotland. They seem to have the ear of every newspaper editor, every politician, and were taken very seriously, even though, you know, teachers who were looking at the group regularly could see that this was a quite a lawless Facebook group. There were very long running legitimate parents' organisations who had great relationships with schools and teachers who were not getting a word in on this, especially groups that were concerned about clinically vulnerable children and want to have schools as safe as possible. Their voice didn't seem to get heard very often. So I had a look. I hadn't had a look for quite a long time. But the kind of things that this group are now getting into are the anti-trans conspiracy theories, fear-mongering about books, and censorship, and still kind of spreading things like this. So I think a kind of long-term thing of COVID has also been bringing schools into the culture wars, conspiracy theory landscape as well. That hasn't really died down, because I think a lot of the groups that were emboldened and given such a voice during the pandemic, this is what we've been left with. To go back to the theme of gaslighting, there's been an uptick in violence in Scotland's schools, although I think those of us who were teaching well before the pandemic knew that this was brewing. And again, it's as if there's a kind of cause and effect being sold to us by the government, that, well, it's like this because of COVID. I certainly don't think COVID has helped at all, but it's not the only thing. There were various reasons why this was becoming a problem before the pandemic. So this is just to show you some sort of screenshots of kind of things that had happened on the run up to the pandemic, kind of where the discourse was headed to, and kind of the long-term effects of that. I know, like, through the group of a lot of teachers who ended up with COVID, long COVID. Even as someone, I wasn't particularly worried for myself. I was still in my 30s at the time, but I did know of a lot of people much younger than me ending up in ICU. I don't think anybody was immune from it. Nobody was guaranteed to be safe from it, but I also had that additional concern about, you know, a pupil who genuinely was at, you know, very, very high risk family members. I also had a really good friend and colleague who ended up getting long COVID, and by the nature of the job, she wasn't able to return to teaching. She did eventually then go on to get a job as a classroom assistant, but again, there's this whole kind of knock-on effect of violence in schools. So as a classroom assistant who wasn't, you know, known to the children, she had the reputation going before her, found herself on the receiving end of a lot of violence. So she's gone from being a very experienced classroom teacher to classroom support worker, and ended up going to work in Sainsbury's. No harm to that at all, but it's not really where she wanted to be. It's where she kind of ended up having to go because of long COVID, because of the lack of adjustment, the lack of safety, and then, you know, the complete lack of safety as a kind of lower paid and essential worker within schools. So that's just a sort of a bit of a snapshot of that time. It's quite a strange thing to look back on now. In the group, we also did some of our own surveys, and what we were kind of being told through national statistics. Now, again, we're arguably looking at smaller sample numbers and people who have, like, self-selected to fill in surveys and polls that we were doing in the group, but we did find that there was a lot, you know, from our members, a lot less ventilation and things like CO2 monitors than we were being told that there were. With regard to the CO2 monitors, I was lucky. I was one who did have one in my classroom, and when it went red, I would take my class out for a walk. But not everybody had that. And then there's also the kind of cultural pressure to sacrifice yourself for the children and to not be taking children out of the classroom to let the CO2 levels stabilise. A lot of people were in a situation where taking mitigation seriously was very much frowned upon and could get you on the wrong side of people that you didn't want to be on the wrong side of. yeah, so that's a bit of a snapshot of where we were with schools back then, and a bit of my own experience of that time.